Hello, welcome back to my channel MCQ and Knowledge Booster. Today I am going to discuss about mechanism of labor in breech presentation. So here first of all we should know what is breech presentation. Okay, so let me tell you. The series of movements occur on the buttock, shoulder and head in the process of adaptation during its journey through the pelvis is called mechanism of labor in breech presentation. Here feto-pelvic relationship for MOL. MOL means mechanism of labor. Feto-pelvic relationship means relationship between fetus and the pelvic bone. So here in breech presentation, lie is longitudinal, attitude that is flexion in complete breech and partial extension in incomplete breech. Presentation is breech or you can say podalic. Presenting part it may be buttock, feet, genitalia in complete breech, and in frank breech there is only buttock and genitalia, and in complete breech only one or both feet, knees. Position is sacro-anterior. Here on the diagram you can see the three different types of presentation. That is A is breech with extended legs, that is frank breech. And in figure B you can see the flex breech, you can say complete breech also. And in figure C you can see this footling presentation. So before starting steps of mechanism of labor, let me clear you one more thing. That is here in breech presentation, okay, the denominator is sacrum and diameter of engagement is bitrochanteric, that is 10 cm. Now let me talk about steps of mechanism of labor. Here principal movements occur in buttocks, shoulders and head. So first of all let me talk about the delivery of buttocks, because this is the breech presentation. So we have to deliver first of all the buttocks. So here engagement. The buttock is engaged when the bitrochanteric diameter 10 cm is at the level of pelvic inlet or lower. The sacrum directs towards the iliopubic eminence. In clinical practice, this translates into a sacrum palpable at zero station. What do you mean by zero station? Here zero station means when the buttock is at the level of ischial spine. Okay, that is known as zero station. If it is above the ischial spine, that is -1, -2 like that. If it crosses the level of ischial spine, that is it becomes plus. Okay, +1, +2 like that. So here bitrochanteric diameter is the distance between the outer points of the hips. Okay, just like same as the biparietal diameter. So next, descent of the buttocks occurs until the anterior buttock touches the pelvic floor. After that, internal rotation of the anterior buttock occurs through 1/8 of a circle, placing it behind the symphysis pubis. All this phenomenon it is same with the vertex presentation. Only here in breech presentation, the buttocks it used to rotate, and in vertex presentation you will get the rotation of the head, that is occiput. Next step is lateral flexion. With further descent and lateral flexion of the trunk, the anterior hip under the symphysis pubis, which is released first, followed by the posterior hip. Gradually trunk will deliver and followed by the lower limbs. After that restitution occurs. Restitution occurs so that the buttocks occupy the original position as during engagement in oblique diameter. After that, delivery of the shoulders. Here first step is bisacromial diameter, that is 12 cm, engages in same oblique diameter as that occupied by the buttocks at the brim soon after the delivery of the breech. After that, descent occurs with internal rotation of the shoulders, bringing the shoulders to lie in the anterior posterior diameter of the pelvic outlet. The trunk simultaneously rotates externally through 1/8 of a circle. After the delivery of the posterior shoulder, followed by the anterior one, is completed by anterior flexion of the delivered trunk. Next is restitution and external rotation. Untwisting of the trunk occurs, putting the anterior shoulder toward the right thigh in LSA. LSA means left sacrum anterior. or left sacral anterior, you can say, and the left thigh in RSA if the position is right sacrum anterior. External rotation of the shoulders occurs to the same direction because of internal rotation of the occiput through 1/8 of a circle anteriorly. The fetal trunk is now positioned as dorso-anterior. After delivering of the shoulders, we have to deliver the head of the fetus. Here engagement occurs either through the opposite oblique diameter as that occupied by the buttocks or through the transverse diameter. The engaging diameter of the head is sub-occipitofrontal, that is 10 cm. After that, descent with increasing flexion occurs. After that, internal rotation of the occiput occurs anteriorly through 1/8 or 2/8 of a circle, placing the occiput behind the symphysis pubis. After that, further descent occurs until the subocciput hinges under the symphysis pubis. After that, head is borne by flexion, chin, mouth, nose, forehead, vertex and occiput appearing successively. The expulsion of the head from the pelvis cavity depends entirely upon the bearing down efforts and not at all on uterine contraction. Delivery of this head, it is depend on the bearing down efforts of the mother. Here I am going to discuss about only two methods of assisted breech delivery. So while doing assisted breech delivery, we have to keep in mind some principles, that is never to rush, never pull from below but push from above. Always keep the fetus with the back anteriorly. Okay. So delivery of the aftercoming head, this is the most crucial stage of the breech delivery. The time between the delivery of umbilicus to delivery of mouth should preferably be 5 to 10 minutes. There are various methods of delivery for the aftercoming head. Each one is quite safe and effective in the hands of an expert conversant with that particular technique. But here today I am going to talk only about two methods, that is Burns-Marshall method and another one is molar flexion and shoulder traction method. Okay, so let me talk about Burns-Marshall method. Here the baby is allowed to hang by its own weight. The assistant is asked to give suprapubic pressure with the flat of hand in a downward and backward direction. The pressure is to be exerted more towards the sinciput. The aim is to promote flexion of the head so that favorable diameter is presented to the pelvic cavity. Not more than 1 to 2 minutes are required to achieve the objective. When the nape of the neck is visible under the pubic arch, the baby is grasped by the ankles with a finger in between the two. In the diagram, you can see properly how they are doing. Maintaining a steady traction and forming a wide arc of a circle, the trunk is swung in upward and forward direction. Meanwhile, with the left hand to guard the perineum, slipping the perineum off successively, the face and brow. When the mouth is cleared of the vulva, there should be no hurry. Mucus of the mouth and pharynx is cleared by mucus sucker. The trunk is depressed to deliver rest of the head. This is all about the Burns-Marshall method. And now let me talk about molar flexion and shoulder traction. Here the baby is placed on the supinated left forearm with the limbs hanging on either side. The middle and the index fingers of the left hand are placed over the molar bones on either sides. This maintains flexion of the head. The ring and little fingers of the pronated right hand are placed on the child's right shoulder. The index finger is placed on the left shoulder and the middle finger is placed on the sub-occipital region. Okay, on the diagram you can see clearly. Traction is now given in downward and backward direction till the nape of the neck is visible under the pubic arch. The assistant gives suprapubic pressure during the period to maintain flexion. Thereafter, the baby is carried in upward and forward direction towards the mother's abdomen, releasing the face, brow, and lastly the trunk is depressed to release the occipital vertex. So thank you for watching. Please do subscribe the channel and like it, share it. Thank you.